The body remembers tension long after the mind forgets pain, storing stress deep inside muscles that guard survival. When the hip flexors tighten, they pull the pelvis forward like a locked hinge, bending the lower spine into quiet strain. Over time, nerves become trapped, not by injury, but by pressure that never leaves. The sciatic pathway, long and sensitive, begins to whisper discomfort and scream through the leg. Relief rarely comes from force, it comes from surrender. Placing a pillow beneath the hip and letting the upper body hang off the bed creates a moment where gravity becomes medicine. The spine is no longer forced upright. The pelvis is allowed to tilt back. Muscles that have clenched for years finally feel permission to soften. In that stillness, the body begins listening again, releasing tension layer by layer, breath by breath, without resistance or fear. Pain often convinces people to brace harder, yet healing begins when control is released. As the upper body drapes off the bed, the hip flexors slowly lengthen, no longer demanded to hold posture. The psoas, a deep muscle tied to fight or flight, senses safety for the first time in hours or years. The quadratus lumborum, often shortened from sitting and stress, starts to loosen its grip on the spine. These muscles do not respond to forceful stretching. They respond to patience. Gravity does the work, gently inviting space between vertebrae. Pelvis stops pulling forward, and the lumbar spine follows, easing its curve. With that shift, pressure on the nerve pathway fades. The sciatic nerve, once compressed, now floats freely through tissue that no longer crowds it. Sensations change from sharp alarms to quiet warmth, signaling relief without effort. This position looks simple, almost unimpressive, yet it reaches places no aggressive stretch can touch. Deep muscles connect emotion to structure, memory to movement. When the body feels supported, it releases what it has been guarding. Hanging backward over the edge of the bed reverses hours of compression from standing, walking, and sitting. Blood flow improves, feeding tissues starved by tension. Breath naturally slows, syncing with the rhythm of release. The nervous system shifts from alert to calm, telling muscles they no longer need to protect. As the pelvis settles, the lower spine decompresses, creating space around sensitive nerve roots. Pain fades, not because it is forced away, but because its cause dissolves. This is not a stretch you push through. It is a posture you allow. Healing happens in the pause, when effort ends and trust begins. Many people chase relief by stretching harder, twisting deeper, or forcing alignment, yet the body resists when it feels threatened. This method works because it removes threat entirely. There is no pulling, no strain, no competition with pain. Gravity applies even pressure, consistent and predictable. The pillow beneath the hip acts as a fulcrum, guiding the pelvis into a neutral position without command. As minutes pass, subtle shifts occur. Muscles soften in waves, sometimes releasing emotion along with tension. A deep exhale may arrive without intention. The lower back feels lighter, less crowded. The sciatic nerve, no longer squeezed between rigid structures, regains space to glide naturally. What once felt like sharp electricity becomes dull sensation, then quiet absence. The body learns that relief is possible without force, rewriting patterns held for years. Over time, this position retrains posture by teaching muscles what relaxed alignment feels like. The hip flexors, often shortened by modern life, remember their natural length. The pelvis finds balance instead of tilt. The lumbar spine rests in a gentle curve, supported rather than strained. With repeated practice, the nervous system stops anticipating pain, reducing muscle guarding before it begins. Sciatic discomfort loses its trigger, no longer provoked by daily movement. This is not about flexibility alone. It is about safety. When the body feels safe, it releases. When it releases, pressure disappears. The simplicity of lying still becomes profound, undoing layers of tension built through years of adaptation. Healing does not always demand effort. Sometimes it requires stepping out of the way and allowing the body's intelligence to finish what it has been trying to do all along. As the stretch continues, awareness shifts inward. Sensations become subtle, nuanced, and honest. You may feel warmth spreading through the hips or a gentle pull dissolving into nothing. The lower spine feels longer, uncompressed, almost floating. This is decompression without machines, without manipulation, without struggle. The sciatic nerve responds best to space, not stretching. When surrounding muscles release, the nerve calms naturally. Pain was never the enemy. It was a signal asking for room. This position answers that request with patience. Each breath deepens the effect, encouraging further release. There is no correct duration, only listening. When the body has had enough, it will tell you through ease. The lesson is simple but powerful. Relief is not something you force, it is something you allow when conditions finally support it. This posture also speaks to the emotional body, where stress hides within structure. The psoas connects spine to legs and fear to survival. When it relaxes, a sense of safety spreads through the system. Thoughts slow, jaw unclenches, shoulders soften without command. The body realizes it is not being chased, not required to brace. That realization alone can reduce pain intensity. The nervous system governs muscle tone, and muscle tone governs pressure. By calming one, the other follows. Sciatic pain often lingers because the body remains vigilant, expecting harm. This position interrupts that loop. It creates a conversation between gravity and trust. Over time, the body chooses release instead of defense. The nerve rests, and movement becomes fluid again, unburdened by anticipation or fear. Consistency transforms this stretch from relief into prevention. Practiced regularly, it resets the baseline of tension within the hips and spine. Daily compression from sitting no longer accumulates unchecked. Muscles recover their ability to lengthen without resistance. The pelvis remains balanced during movement, reducing strain before it begins. Sciatic flare-ups become less frequent than rare. This is not a quick fix, but a quiet correction. The body thrives on gentle repetition, not aggressive intervention. Each session reinforces safety, teaching tissues they can let go sooner next time. The nervous system learns a new pattern, replacing guarding with ease. Pain loses its role as messenger because the message has been received. Space has been restored. The nerve rests, and the body remembers how to move without fear. The beauty of this approach lies in its humility. No equipment beyond a pillow, no force beyond gravity, no demand beyond stillness. It reminds the body of its original design, where movement followed rest, not tension. As the upper body hangs freely, the spine remembers how to decompress naturally. As the hips soften, the pelvis returns home. Sciatic pain fades when its environment changes, not when it is attacked. This position changes the environment completely. It offers room, time, and safety. In that offering, the body responds with release. Healing becomes less of a battle and more of a return. The nerve calms because it is no longer compressed. The muscles relax because they are no longer afraid. The system resets itself, quietly and effectively. When you finally rise from the bed, the difference is subtle yet unmistakable. Movement feels smoother, less guarded. The lower back no longer grips with every step. The leg feels lighter, free of sharp signals. This is the after effect of space restored. Not all pain disappears instantly, but the direction has changed. The body is no longer spiraling towards tension. It is unwinding. Each repetition deepens that unwinding, reinforcing a pattern of ease. The stretch does not fight the body, it listens. And when the body is heard, it responds. Sciatic relief emerges not as a dramatic moment, but as a quiet realization that the pain is no longer in control. Space has returned. Calm has replaced compression. The nerve rests, and the body remembers how to move without fear.